Welcome back. In your morning medical news, scientists are tracking measles through your sewage. Researchers are using wastewater testing to detect the virus as measles cases rise across this country. It's similar to COVID pandemic tracking when sewage testing helped identify early transmission signs. The new national program can potentially spot cases days before people show symptoms or see a doctor. It's now available at dozens of treatment plants in 40 states. Meanwhile, Minnesota health officials warning Mall of America visitors about potential measles exposure. An unvaccinated child recently diagnosed with measles visited an indoor theme park at the mall on May 24th. Anyone at the mall that evening could have been exposed, and you should monitor for symptoms through June 14th.
It is spread by talking and laughing and singing. And unfortunately, it can hang out in the air and infect others for up to 2 hours, even after that infectious child, in this case, leaves that airspace, which is the reason that we're out here really warning the public.
As of this week, more than 1,100 measles cases have been reported in the U.S. It is one of the most common cancers in U.S. men. About 1 in 8 will be diagnosed with prostate cancer in their lifetime, according to the American Cancer Society. The disease also a leading cause of cancer death among men, but early detection can save lives. Mandy Gaither has more on who should be screened for prostate cancer and when to start that screening.
If found early, prostate cancer is highly treatable before it spreads. But the American Cancer Society estimates there will be more than 35,700 deaths from the disease in the U.S. this year alone. Screening can save lives, but knowing who should screen and when can be confusing.
PSA screening is so complicated because different organizations have come out with their own thoughts on what that screening interval should be and shouldn't be.
Dr. Mitchell Humphreys with Mayo Clinic says most organizations agree that men at average risk should get their screening between the ages of 55 and 69. It's a blood test known as prostate-specific antigen, or PSA. But he says the decision to start screening should be made between the patient and their doctor based on risk. Those more likely to develop prostate cancer include anyone with a family history of the disease, or those who may have inherited the BRCA genes typically linked to breast cancer. Black men are also at higher risk. Humphrey says anyone with these risk factors should start screening earlier than those at average risk. How often a patient should be screened also varies, so he recommends what he calls smart screening, meaning those who have a history of higher PSA levels should be monitored and screened more often than someone whose levels are low.
You can tailor it to the individual health and the risk of the patient to determine how often you should be having that blood test checked for your health and longevity.
The American Cancer Society says men with less than a 10-year life expectancy shouldn't be screened for prostate cancer since the disease grows slowly and screening could lead to unnecessary procedures.